Hello guys, welcome to my YouTube channel Learning Tips underscore Farm. Uh, I'm I'm here with a small introductory video for the first year student of pharmacy. Just how what is pharmacy is. I just want to introduce about the subjects and what the content of the subject. Not in detail, but just a brief introduction. So let's start. Uh, it is very often to have questions like what is pharmacy, especially to those who are completely new to the pharmacy, and even for for those people they just wanted to know about the pharmacy. What is pharmacy? What are the different subjects in pharmacy and all? So this is a small video. So let's start with it. What is pharmacy? When you search the word what is pharmacy, so you may get the definition like pharmacy is a branch of science which deals with collection, preparation, standardization, compounding, and dispensing of drugs in such a way to make the medications suitable for easy, effective, and palatable administration in the treatment of disease. It's a definition with a very high words. So it is very difficult to understand for the new people. So let's start. Make it easy. Pharmacy is all about the medicine. Start from the information about the drug till to the how to sell a medicine in a medical shop. And not exactly we will learn how to sell, but the things that we used to learn in the pharmacy course that will help you to set up the pharmacy shop and have a business. Throughout the degree and diploma of the pharmacy, we will learn about the different physiological functions of normal human body or normal human physiological functions. Along with that, we used to study different types of diseases and the different use of drugs. And not even the only use, their chemistry, their uses, their positive effect that is meant beneficial effect and the negative that is mean the side effects of the drug. We will also learn that what are the different types of dosage form, how to prepare that different type of dosage form, or for the preparation of dosage form, along with the active material, we need a non-active substances. There are lots of substances and there are varieties of category of the substance that we used to add while preparing the dosage form. Like for a tablet, we used to prepare tablet. We need lots of substance like binders, what is diluents and all. These are very different terms. I am going to make the another videos on the that terms. That is the important terms that you must know while starting your pharmacy course. And along with the dosage form, we also learn about the sources of drug, their identification, collection, and processing to determine its quality and purity. And as it is a technical course, you have to undergo extensive practical session, and the practicals are really good because personally I said that I used to enjoy the practicals a lot, because we used to learn the different things in theory classes, and we actually apply that theory knowledge in practicals. So if we learn about the tablets, so how to make the tablets, what are the different methods of making tablets, we actually make a tablet in lab. We have to make it. It's our practical, and we have the practical exams too. So it's very interesting. Then what are the different subjects in pharmacy? Though we have basically five core subjects, and they are like pharmaceutics. It's the heart of pharmacy because in the pharmaceutics you actually learn about the different types of dosage form and all. I'm coming on that things later on in the video. Next is the pharmacognosy. Here you learn about the crude medicines. Then the pharmacology. Here you learn about the different drugs, their uses for different diseases. It is the chemistry. Chemistry is extends to pharmaceutical chemistry. Actually, the chemistry is a it's a branch of the basic science also. And in pharmacy, we used to learn those part that are related to our drug or our pharmaceutical sciences. So we used to call it the pharmaceutical chemistry. And then the molecular biology. Molecular biology is the part where we used to learn about the microbiology and the biology. We will see as we proceed to in the video. So we have, as we have the 5 core subjects, along with the 5 core subject, we have varied allied subjects. So they are interconnected to the core subjects, or they are the parts of the core subjects, like pharmaceutics. For the pharmaceutics, we have the physical pharmaceutics, industrial pharmacy, novel drug delivery system, and the biopharmaceutics. I'm not going in very much depths for each and every subject. It just I'm giving you the initial brief knowledge about what the subjects that you are going to study and what are they linked to. Okay, then we have the chemistry. In chemistry, we have the organic chemistry. That is, we used to call it as a pharmaceutical chemistry, pharmaceutical organic chemistry, inorganic chemistry, biochemistry, and the analytical chemistry. Analytical chemistry, you must may have the pharmaceutical analysis, where you learn the different analytical techniques for the pharmacy. Okay. Then we have the pharmacognosy. Pharmacognosy, actually, they mention the subject name as a pharmacognosy and the phytochemistry. The phytochemistry is related to the chemistry of the uh, phytomolecules that you used to find in the plants. Okay, not only in the plant, the natural source, the chemistry of all the plants, that how the structure and all. Next is the herbal drug technology. There is another subject called the herbal drug technology, or when you go for the M pharmacy, there is a special branch, herbal drug medicine and all. So it is not the aligned subject, but they given the name the pharmacology and phytochemistry to avoid the confusion. I mentioned over here. And next is the pharmacology. The pharmacology is start with the very basic subject, human anatomy and physiology. It's not the part of the pharmacology, but yeah, it's a start from the human anatomy and physiology, because in human anatomy and physiology, you will learn about the normal human anatomy. What is meant by anatomy? Anatomy is like the what is the structure of your each and every part. Like if you want to study the heart, what is heart looks like, what are the different parts of heart, and its physiology, how it works. Then it's a pathophysiology. Pathophysiology is like a study of different diseases. And after human anatomy, physiology, pathophysiology, you will come directly to the pharmacology. Pharmacology is special subjects in the pharmacy. Then we have the microbiology sections. In microbiology, we have the molecular biology sections. In molecular biology, we have the microbiology and the biotechnology. Not only the above mentioned subject, you may find a different subject in the syllabus, but they are all related to the either core subject or somehow the other parts of the subject. Like you have the pharmaceutical engineering part, where you learn all the different apparatus, or the what we call the machines that we are going to use in the industries. Okay. Then just start some introductory, brief introduction for the subject, what that subjects may you have to study. It's like the first we come with the pharmaceutics. It's as it has of pharmacy. Study of different formulations, their types, routes of administration, method of preparations, and all the information related to the formulations. How to make the formulation, start from the different materials, categories of material, till the packaging of the formulations. Each and everything you will learn over here. Along with the basic formulation, you will learn that you will get the knowledge about the advancement and newer techniques for the advanced formulations. How to make the advanced formulation? Like initially, what we have used to have a simple tablet. We have to take the tablet thrice a day. Like when in childhood we have to take the tablet in morning, in afternoon, in evening. Nowadays we have to take a single tablet for a whole 12 hours, or for sometimes for 24 hours. That is the advancement in the formulations. And it also have the different information for the different instrument required to develop the formulations, like not only for the development of formulations but also for the characterization, because if we are making the formulations, we have to check its quality of the formulations. Then we have the chemistry, that is pharmaceutical chemistry. In chemistry we will get the knowledge about the chemical properties of drug molecule, drug chemical identification and evaluation, study of different drug structure and their uses for different disease condition and relevant data. Also in chemistry we have the pharmaceutical analysis subject. I am categorized as in pharmaceutical analytical chemistry. It is because it's an analysis of drug basically, and different use of different instrument for the analysis and their study. Then we have the pharmacology. Pharmacology, as I said earlier, it starts with the human anatomy physiology. It is the study of structure and normal functions of the human body and physiological function. Then we have pathophysiology, which have the whole study and deep study about the different diseases. In pharmacology, we have to study the drugs, their uses, and their actions and reaction. That is beneficial effects and the side effects also. Then we have the pharmacognosy. In pharmacognosy, you will study about the crude drug material, information about the sources of drug, their constituent, their collection, their extraction, isolation, identification, standardization, and many other interesting things related to the processing of crude drugs from natural sources. Then we have the molecular biology. I said earlier, microbiology, molecular biology. We have the microbiology and the biotechnology. In microbiology, we used to study about the different microorganisms like bacteria, viruses, fungi, their structure, their properties, their cycles, how they developed, and all we used to study in microbiology. Along with this, there are the sterilization techniques, how to get rid of these microorganisms. We have to study also, and all the associated information. In biotechnology, we have to study the DNA, RNA, and genetics, because as we are developing to the advancement, we are going to the advancement. There is a advancement in the medicine also. We are used to we are generating the medicine according to the DNA, RNA of the human body, so that it will come up with the less side effect and the highest positive effect. Then we this is just a brief introduction to for subjects and the pharmacy. Now, once you start with your course, if once you got admission for the pharmacy course, how could you start? From where to start? And what you have to do in that course is like after getting the admitted to the course, you must collect the syllabus copy from the college or download it from the internet, because syllabus copy is the only document that will give the information about the different subject and their topics that you have to study for that particular year or for that particular semester. Okay. And it also have the list of references book for that particular subject. Okay, you must go through it. Then once you obtain the syllabus copy, and you start with the lectures and practicals, you must focus on the concept. Guys, you from start of your course, you must focus on the concept. Try to understand the concept, because once you understand the concept, you will probably gonna develop the different things, and you will gonna understand all the things related to that particular topic. And in practicals, you have to understand the key parameters of how to develop that drug or dosage form. You must know the what are the essential things for that particular dosage form or for the particular practicals. Prepare your own notes from time to time and get them checked from the associated professor, because once you start preparing your notes, you will understand what things, because and it will help you for the preparation of your exams also. uh, do not rely on the PowerPoint presentation, because your teachers used to prepare their PowerPoint presentation to teach you, and they will provide you that PowerPoint presentation as a guide. what you have to study in that subject. Okay, but do not completely rely on that presentation, because these are just the key points we used to put in the presentations. If you want to know about that subject, about the concept, you must go and refer the reference book and try to clear your concept. And this all about the just the introduction, about the brief introduction of the pharmacy. I'm going to prepare my next video for the different key definitions and important definition we used to say, and that you must know throughout your course from the start of your career in pharmacy. Like, share it, subscribe करिए, and follow my Instagram link learning tips_pharma, where I used to put the small images that will help you for the your preparation. I used to put them